Good evening, all. Once again, I'm Dr. Alok Arora, clinical psychologist. I'm here with the session today on ABA therapy from tantrums to learning. So many of the times I get this question from parents, different professionals, what is ABA therapy, whether this is useful for children with autism or not. Sometimes there are some concerns also, like if my child will become robotic if I go with ABA therapy, or can I do ABA therapy with my children, own child as a parent, or I'm an occupational therapist, or I'm a speech therapist. How do I make use of ABA approach into my therapy, and how it would be helpful for me? So I'm here to answer all those questions today. So I will first share my presentation. I'll speak about what ABA therapy is and how we can transform the tantrums, the behaviors of concern into learning with the help of ABA therapy. And post completion of the presentation, I'll be open to questions. So you can keep on typing your questions on the screen in the chat box, and I'll answer all the questions one by one. Let me just begin my presentation first. So from tantrums to learning, how ABA therapy changes the life of children with autism. What is ABA therapy? What is ABA? Applied Behavior Analysis. So it is a scientifically valid approach to understand what is behind the behaviors, why children with autism have different behaviors, which are behavior of concern, which sometimes or most of the times we call them as tantrums. And it utilizes data collection and analysis. It is a scientific approach, so definitely it is based on some principles, evidence-based interventions, focuses on observable and measurable behavior. So it does not talk about just the behaviors, but it measures the behavior as well. So observable and measurable behaviors it focuses on, and utilizes the principles of learning to increase or decrease the behaviors. So to increase the preferred behaviors that we call acceptable behaviors, and to decrease the problem behaviors or behavior of concerns or tantrums. So let's understand autism behaviors. What kind of behaviors which we usually see? So autism spectrum disorder is a neurodevelopmental condition. We all know that, and that affects communication, social interaction, behavior patterns, and learning abilities. Many children with autism express needs through tantrums or challenging behaviors. So the challenging behaviors we name as tantrums here. So in autism, what all are the common challenging behaviors? What we see, the tantrums. Usually, often we see emotional or behavioral outbursts like crying, screaming, hitting, self-hitting or hitting to others, throwing objects, uh, falling on floor, lie down on floor, or running away. These behaviors are often communications attempts. These are not behaviors, but we should understand by doing these behaviors, child is trying to communicate with you. That's what we call behavioral communication. So it's a language of child that child is speaking with you. Since child is not able to express his or her emotional needs or the feelings or the like demands, the needs. So that's why child is expressing them through these behaviors, which becomes a matter of concern for us, like crying, screaming, hitting, throwing objects, falling on floor, running away, etc. So they become matter of concern. And because of that, sometimes our children are socially deprived also. Sometimes, not sometimes, often we see complaints from the schools to an extent that they ask us to take the name off for our child from the school. So these are definitely matter of concern that needs to be addressed. So why these tantrums occur in autism? As I said, these are communication attempts. So children with autism, they often have communication difficulties, sensory overload. So they have sensory overload, sensory issues, which are overburdening them, or they want to escape from difficult tasks. Sometimes the behaviors are attention-seeking behavior also. and difficulty understanding instructions. If you are giving them multiple instructions at one go, they are not able to follow or understand. That time also children show the behaviors and their own frustration. Day to day, just imagine yourself in place of that child who is not able to communicate his needs, wants, his feelings, who's not able to express his feelings, who's not able to connect with the society, connect with peers, who's finding it difficult to give attention, and who's impulsive, who's not able to wait for his own turn, or not able to get involved in activities altogether. I mean, imagining things is difficult. Structure is something that they struggle with. So imagine the all that frustrations child is going through. So these tantrums are the outcome of these frustrations. Children with autism should not be punished for tantrums. Punishment is not the solution. Punishment can give you temporary relief, or sometimes we see that the behavioral concerns increase with the punishment. Rather, what we need to do, what should we be doing is we should keep our mouth shut. Do not give them any more instructions at the time of tantrum or behavioral concerns. Listen to them and keep your eyes wide open. Observe. So observe and listen. Now, there is a very thin line between tantrum and meltdown. These are two different conditions. Tantrum is behavioral concerns, but meltdown is totally different. So tantrum is always goal directed. Child is doing tantrums for some activity or some escaping from activity or wanting a chocolate or any need. That is tantrum. And meltdown is not intentional. Meltdown is usually overlooked. So in tantrum, child wants something, whereas in meltdown, child is overwhelmed. Tantrums stops when the need is met. Need is over, tantrums are over. But meltdown takes time to calm down. It takes its own time to calm down. Tantrums are often social, but meltdown are either sensory or emotional. So in ABA therapy, we work on both the concerns, but today's lecture, since it is more related to the tantrums to learning. So let us understand how tantrums affect the learning. So frequent tantrums lead to disruptive classroom learning, difficulty following instructions in the classroom, even at the home or other environments, reduced social interaction. Child is not able to connect with neighbors or peer children or other people around. So social interaction reduced, increased stress for parents. So it does not only affect the children, but it also affects parents very adversely. Because if a child has meltdowns, behavior concerns, parents are not able to take that child out with them in social settings. Parents get frequent complaints from neighborhood, frequent complaints from the school teachers, therapy centers. And sometimes they are blamed for a bad parenting. So in general, when people who do not understand the tantrums, they consider it as the outcome of bad parenting. So it increases stress for parents and it affects in development because it is directly related to the learning. So development gets delayed. What is ABA therapy? In very simple words, applied behavior analysis is a scientifically proven therapy that helps children with autism learn new behaviors and reduce problematic ones. So we want to teach new skills to children, new behaviors, new activities, ADLs, that all we can do through the ABA therapy. And we can reduce the problematic behaviors, the tantrums through ABA therapy. So it focuses on teaching skills, improving communication, reducing challenging behaviors, and increasing independence. Question comes, who can practice ABA therapy? So if you want to name yourself as certified ABA therapist, there are different training programs from BCBA, from CABA, from CIPD. So they are internationally, there are different training programs. But in India, you need to be a psychologist and trained on ABA to practice as ABA therapist. But to practice as certified ABA therapist. But it's an approach which parents can learn and apply, and it gives wonderful results, which all the therapists occupational therapist, speech and language therapist, behavior therapist, or anybody who is working, even the caregivers who are working with children, in my personal belief, everybody should understand and learn the principles of ABA and include them in your regular therapies, and you'll see wonderful results. So we are working on, with the help of senior occupational therapist, Dr. Kanan Doshi, who is 32 years experienced MOT and have been working with pediatrics. She's also the co-founder of the Able company. We are working with her on a new integrated approach that's called Sensi ABA, sensory integration with ABA therapy. So we have named it as Sensi ABA, and for past 2 years we have been working on it, and it's giving us wonderful results. So ABA approach can be clubbed with any other approach. So what is ABA approach? Now let us learn about it. It is evidence-based therapy. So there is an evidence. It has been in existence over 50 years. So for over 50 years, it has the research evidence. It is recommended by American Academy of Pediatrics, World Health Organization, and all over the world autism research organizations. They have recognized it. Even the government of India the RCI has also recognized it now. The key principles of ABA is behavior is influenced by environment and consequences. So our behavior is not an independent activity. It is influenced with the environment I am into and what are the outcomes of this behavior. That's called ABC model. That is the foundation model of ABA, foundation principle of ABA. Antecedent, behavior, consequence. So if I want to change a behavior and I work on behavior, I'll not be able to change it. Because to work on behavior, I have to give more instructions to the child. Child is crying. I need to give instructions. Stop crying. Stop crying, otherwise mama will not give you this. Or we have to shout at the child, or I have to give some punishment to control the behavior. So here in ABA, we do not talk about controlling a behavior. We talk about changing a behavior, replacing it with a desired behavior. So we understand all behaviors are communication attempts and they are influenced with environment and consequences. So antecedent, what has happened before the behavior, what is the environment, who all are involved with the child, what child was doing before, all of this context is antecedent. Behavior is observable, measurable actions of the child. So only those actions which you can observe and measure. Observe with your eyes, you can view, observe, and measure in terms of intensity, in terms of duration. That is behavior. And consequences, what did child achieve by doing that behavior, or how did behavior settle down? That is consequence. So we don't have to work on behavior in ABA. Rather, we work on antecedent and we work on consequence. So you change the consequence, automatically behavior changes. Or you change the antecedent, automatically behavior changes. So ABA people are the trained people who work on antecedent and consequence. So this is the key principle of ABA therapy, that's called ABC model. And goal of ABA therapy is to increase helpful behavior. So it is not only always to work on tantrums. ABA therapy helps us to teach new skills and new behaviors to the child. So increase helpful behaviors, reduce harmful behaviors, teach communication, improve social interaction, and build independence. So when we work in ABA with children, we work with helpful behaviors, increase them, work on the tantrums, help them to improve their communication and social interaction. And then ADLs, activities of daily living, independence, all these areas we can target through ABA. So how ABA converts tantrums into learn? Let's look into that. Now, these are the major principles that we use in ABA. So first of all, we list down the behaviors of concern. What are the behaviors that are affecting child's development? What are the behaviors that are affecting child's learning? So we list down and then prioritize them. Which behavior we need to work first, then the second, then the third, then the fourth. And there might be some behaviors which are still acceptable, which we keep them aside as accepted behavior. We are not going to work on each and every behavior. Rather, we categorize them on basis of the priorities. Then do the ABC analysis of those behaviors. Just now I've told you ABC analysis is antecedent, behavior, and consequence. So after ABC analysis, we understand the functions of behavior. So what are the functions of the behavior? So each behavior has majorly either of the four functions. So all behaviors of children with autism can be categorized into four reasons. Function, when I say, basically reasons of that behavior, why child is doing that behavior, what child is achieving by those behaviors, that is called functions. So what are these functions? Attention, escape, tangible, and sensory. So child does a behavior either for attention, like in a classroom setting, child is interrupting the class, making sounds. That is for seeking attention. Escape. In the same classroom setting, child is making sound because child gets punishment to stand out of the class. So this punishment which you give to child, if child is disturbing the class, stand out of the class, becomes escape mechanism for the child. So child who is finding the class difficult, child who is not interested to attend the class, they try to disturb the class for escape mechanism. Then tangible. Tangible could be for an object or an activity also. A child who is playing Ludo with you suddenly throws away the cardboard, Ludo board. This is again a behavior of concern. First 15 minutes child is playing, and then after that child just throws away and runs. It could be for escape, the child is tired of this activity, or tangible, the child does not want to play Ludo, child wants to go out in the playground. So if you understand the antecedents and consequence, you'll be able to find out what is the function of this behavior. And then there are many behaviors in autism which are sensory driven behaviors, which are for my sensory integration needs. That I close my ears when the loud sound is there. That I repeat words, repeat sentences. That I go and keep touching different objects, different people, their skin. Whosoever I find a new person, I just go too close to them and then hold them, touch their skin. Tactile behaviors. All these are sensory driven behaviors. I close my eyes in bright lights or when lights are fluctuating, dimming or sharpening, brightening. So I close my eyes. These all are sensory behaviors. So all the behaviors of a child with autism, you can majorly categorize into attention, escape, tangible, and sensory. So in ABC, what we do is list down the matter of behavior of concerns, then do the ABC analysis and understand what is the antecedent, what is the consequence, and then relate the behavior with function. What is the function of that behavior? Then for the same function, we need to teach replacement behavior. If you just ask the child to stop the behavior, now say, I'm hungry. And if you just ask me, try to divert my attention, how long will you be able to do it? You'll say, okay, come and watch movie. Fine, I'm interested in movie. I will come with you. I'll watch movie. You have diverted my attention. But for how long? The hunger will still disturb me. After 15 minutes, 20 minutes, 1 hour, 2 hours, 3 hours, I'll again do exhibit the same behaviors to get my hunger sorted. So what you need to do is to stop a behavior, you cannot just divert the child from that behavior, or you cannot just play with antecedent and consequence. You also need to teach a replacement behavior, because behavior is communication, behavior is need of the child. So child is expressing that need by crying. Now, if child wants a break and child is expressing the need by crying in middle of a therapy session, in middle of a classroom. So what we need to teach to the child? That if you need a break, you need to raise your hand. The child raises hand, we give the break, crying behavior automatically stops. So that is called replacement behavior, a behavior that is desired in that situation instead of the behavior what child is doing. So instead of stopping behavior only, ABA teaches better alternative behavior. So instead of tantrum, teach. When child needs help and child is finding it difficult, child shows tantrum. So throws away the book. So instead of tantrum, whenever child needs help, child should say help please if child is verbal. So teaching child the saying help please is called replacement behavior. So first we analyze the concerns, behavior of concerns, then we do the ABC analysis, and then we connect it with functions and then teach replacement behavior. For teaching replacement behavior, we have different strategies like positive reinforcement. So positive reinforcement means rewarding good behavior so it increases. Now, whenever child does a good behavior, like whenever child is using replacement behavior instead of crying behavior or tantrum behavior, we reinforce that behavior by giving some candy, chocolate, chips, or favorable toy, or sticker, or verbal praise, appreciating it, clapping for it, smiling for it, or giving attention. Giving attention to the child can also be a positive reinforcement, or giving extra playtime to the child. So that is called positive reinforcement. Now, reinforcement cannot continue forever, remember. So we need to give reinforcement initially at a very on every attempt of child, and then slowly we need to fade away the reinforcement. We need to give it on different schedules. There are different techniques to do that in detail. If you learn ABA therapy, you will understand this, how to fade, like on which intervals, fixed intervals or fixed ratio, or variable intervals, variable ratio. This is how we fade the reinforcement. Otherwise, child will seek reinforcement for every good attempt. In the practical world, we cannot keep on providing reinforcement for rest of the life. Then comes prompting. Prompting is another technique which helps children to perform correct behavior. So prompting is giving them some clues. You all might have seen when you go for a function where like a family celebration or a wedding function where some sort of performance is there. So people perform on the dance floor, and there the choreographer stands down the dance floor and gives them prompts. Do this, do this, do this. So all of these prompts are called, all of these actions what choreographer is giving support to for the people to do it, called prompting. So prompting can be verbal, gestural, physical, or visual. So it's like giving child hints what is expected from the child, what child should do in this situation. So when you see that child is taking session therapy or classroom for 15 minutes or 20 minutes, and you know that child is going to cry about after some time because child might need help, a break. So you give prompt. You give prompt of break. So if you have taught the child to raise hand for break, so you just say raise hand. Child looks at you and raises hand. And then you give verbal prompt also. You want break, then raise your hand. So child raises hand and you immediately give break. So child understands that whenever I need break, I need to raise it. That's how we need to do prompting for the children. But prompting cannot, again, like reinforcement, prompting cannot be forever. So you need to fade also. Gradually reduce the help. So initially you started with gesture and verbal also. You need break, raise your hand. Then later you just go on verbal. You need break, raise your hand. Child raises your, give the break. Slowly you go, instead of you need break, you just say raise your hand, child gets the break. And slowly you remove completely. So you go for you just say hand, child raises hand. And then you even don't say hand. Whenever child needs break, child will start using this as a replacement behavior. So instead of crying, child has started communicating to you with acceptable behavior. Behavior that is accepted by us, by society. Then we need to, now when we want to teach child new skills, this was about the problematic behavior. Now I'm coming to new skills or the tasks, the ADLs, where child is not comfortable and child shows behaviors. So we do a technique that is called task analysis. So task analysis is breaking complex tasks into small ones. Tasks which we feel are very easy or we feel they are very small tasks can be very big tasks for children, because children with autism, they have concerns in multiple areas. motor movements, fine motor, gross motor, communication. So they might find the same task as difficult. For an example, pick, doing toothbrush. So for brushing teeth, child needs to pick the toothbrush, apply the toothpaste, open the lid of toothpaste tube, close the lid. The child should learn this, apply it. So the motor movements, fine motors, gross motors should be aligned to do that. And then move it in the brush, in the teeth, brushing teeth, and then rinsing the mouth. So same task of brushing the teeth, you break into smallest possible tasks. Another example, child is thirsty and child wants to drink water. So what all tasks are involved in drinking water? Child has to go to the kitchen, find the tumbler or the glass in which he wants to pour the water, then open the fridge, take the bottle out, open the bottle, lid of the bottle, pour the water into the glass, close the lid, keep the bottle back in the fridge, and close the door of the fridge. Drink water, put the glass into the sink. Now, child needs to be trained on each task separately, not in a complex way that within a day we are teaching everything. So for first 5 days, depending upon child, you need to understand child's learning curve, how child is learning and grasping power and this current level. So at times we take 1 week for a child just to open the lid and close the lid to teach them this. Or for 5 days, we teach them how to open the fridge and close the fridge, how much pressure they need to put while closing. Otherwise, they just bang the fridge door. That is socially not acceptable again. So likewise, we do task analysis. Any task child is supposed to do, we do the analysis for the task into smallest step and teach children those steps. Then comes shaping. Shaping means rewarding small improvement. So task analysis, when child is able to do even the small task, we give rewards, reinforcement. So looking at teacher, reward, sitting 1 minute, reward, completing activity, reward. So in terms of reinforcement, sometimes verbal, sometimes as praise, verbal reward, reinforcement, sometimes with material, with candies, toys. Likewise, we keep on changing the reinforcement, but we give reinforcement on the small improvements also, even at the attempts also. So it's not only the improvements or the behaviors, acceptable behaviors that should be appreciated or rewarded or reinforced, but attempts of doing it. Even if child is trying to do it, we reward the child, we reinforce the child. Then only child gets motivated to do it. Most of the time we see that when child is trying to do something, we try to correct the child. No, you are doing wrong. You are not supposed to do like this. You should do like this. And in this process of correction, child gets frustrated and child goes back to the tantrum behavior because child finds that easy. So child starts crying and gets his needs done. So even not only the desired behaviors, but attempts of those behaviors should also be rewarded at a smaller scale. Not necessarily child is able to complete the whole behavior, whole task. But even if child is doing part of it, that particular part should be rewarded. There are different strategies. Now, these were the principles, the things we use. And then we have different types of trainings and strategies that is used in ABA therapy. Discrete trial training, DTT. So discrete trial training is a structured teaching method in which instructions, response, reinforcement. It starts with slow phase, but goes into quicker phase. Like we give reinforcement to the child, touch nose. So child touches the nose. And we say, good job. So that is DTT. So instruction, you give the instruction, child follows the instruction, we reinforce that instruction. Then second time we say touch nose, child touches the nose, we give a candy. Third time we say touch the nose, child touches the nose, we give it like one piece of biscuit or chips, or just clap for the child. So we keep on changing those reinforcements in discrete trial training, but every response is reinforced initially. Later on, again, depending upon the fixed ratio, variable ratio, or fixed interval, variable intervals, the response are being reinforced. Like every third attempt is being reinforced. Then randomly attempts are being reinforced. And then duration of attempts. So initially every attempt, then every third attempt, then every randomly like third and fifth attempt, seventh attempt is being reinforced. And later on, only one attempt out of 10. So 10 times child is giving correct response, only one time we give the reinforcement. Slowly, we increase this duration and fade away the reinforcement. Then we have other strategy, that is natural environment teaching. So whatever we are teaching to the child in a therapy center, in ABA, or classroom settings in ABA, that we try to include the same strategies in child's entire environment. Now, what is child's environment? Home environment, school environment, therapy center environment. These are the three, or the public places like garden, mall. These are the major environments where child moves into. So learning happens during play or daily activities. Child wants a toy, encouraged to say word toy. Not only during the therapy, but during routine. Child wants water, encouraged to say water, or teach the skills to have water. So if a child has learned the skill to open the bottle and pour water at home, parents follow the same strategy. So they start making child independent. So say the teachings, what we are doing in the therapy center or the classroom settings, are converted into their daily routine, natural environment. We provide visual supports to them, like picture cards, visual schedule, first and then boards. So we all know that autism children are, most of the time, they are visual learners. Many of the children, they enjoy learning through visuals. So we provide them picture cards, visual schedules, or what to do next. So first this, then next is, or 1, 2, 3, 4. So one, first task, second task, third task, fourth task. Likewise, we use picture cards or other supportive communication. What after ABA therapy now? Teach children to communicate needs instead of tantrums. So from tantrums, we have brought the child into communication, communicating needs, behavior. So instead of screaming, child learns to request for scream. Maybe verbal or non-verbal. Maybe through the gesture or through verbal or through a picture card. But screaming goes down. Screaming reduces. Finally, like when we provide structured ABA therapy for a longer period, screaming behavior vanishes. Consistency is the key. So children learn faster when home, school, and therapy center use the same strategies and consistency. Consistency is definitely the key in ABA. Some myths about ABA. So the most common myths, when I Google it out, also I get the most common thing. ABA forces children to behave like robots, or they say that this training ABA therapy was developed for pets. No, ABA, when used scientifically, because ABA is applied behavior analysis, is a scientific evidence-based therapy. So you need to use it. Science depends on principles. So if you don't use the principles of fading reinforcement or prompt fading, child becomes robotic. So not only providing the reinforcement, but learn to fade the reinforcement, learn to fade the prompts on various intervals. Fixed interval to start with, and then go for variable intervals or fixed ratio, variable ratio, all of these. If you practice those principles correctly, the outcome is correct. But if you don't practice them correctly, if you don't learn them and then do it, then yes, it may make your children robotic. So ABA teaches useful life skills, ADS, behaviors, and new learnings to the child when used scientifically. That is why a structured training program is required for ABA. So ABA stops natural personality, child becomes dependent on the commands. No, ABA improves independence and communication. ABA therapy is developed to make children independent in autism. So it works on independency, of the children. So these days, we work on comprehensive ABA, where we are including a lot of ADLs, lot of communication attempts, and natural settings and social trainings. So including all that together makes children a better behavior, better on their behavior or learning. So from tantrums to learning, how it changes. So before ABA, child was frustrated, child was showing challenging behaviors and learning difficulty. And after ABA, child is doing communication, child is participating, and skill development is taking place. So from learning difficulty to skill development, from challenging behavior to participation, from frustration to communication. That's what ABA can take us. Now, how do I learn ABA? So yes, there are different programs, different modules available for ABA therapy. With the JKP Care Foundation, also we have a training academy where we are running over 32 types of training programs as of now, ranging from 1 month to 1 year, from the certificate levels to diploma levels. So for ABA, we have level 1 and level 2 trainings, which is level 1 is for 1 month and which talks about the foundations, principles of ABA, and level 2, which is for 2 months, is practical application of those foundations. So first month is foundation. All these principles in detail you will be learning. And second month, third month are the practical applications. So you'll be learning how to apply them practically and what are the challenges we face. The whole module, both the modules are in online mode. Level 3 we have in Bangalore, India, in which is hands-on practice. So anybody who wants to work with children and wants to do hands-on practice can go for level 3 also. So if you all are interested, you can visit our website, www.jkp.ngo, and connect with us for any kind of support and guidance on ABA. Parents can learn it. All the therapists can also learn it. And psychologists, of course, they can definitely learn and practice it. Key takeaways are behavior. Every behavior has a reason. Understanding behavior is important, not just looking at the behavior and stopping the behavior. ABA teaches alternative skills to children, and consistency leads to the progress. So behavior is communication. When we understand it, we can transform lives. So consider every behavior of your child as form of communication. Look behind what child is trying to communicate to you with that behavior. That's all from my side. Thank you very much. I will stop the presentation now. I am available on www.dralokarora.com, or you can visit our organization's website, www.jkp.ngo also. I'm open for the questions now. Questions anyone has? Let me just look at the messages which you all have sent me. So do we have any questions? Anyone? Post completion of this session, you all will be receiving via email or via WhatsApp, you all will be receiving the link for reviewing the session, how the session was. So kindly rate us, give reviews, and we are here to support you. JKP Care Foundation is trying to create a lifelong support system for the families of children and adults with autism. We also run a residential rehabilitation center, which is in outskirts of Mumbai, in Maharashtra, India. So there, it's a specialized center only for autism adults. So 18 years and above children with autism, up to any age, are welcome to come and stay with us. We are working on respite care, short-term stay. We are working on the long-term stay and lifelong stay also. So even the guardianship. So we work on behaviors there, ADLs, and vocational trainings. So if there are any questions, you can put it in the live chat in your YouTube. I can answer your queries. So usually we do the webinars on YouTube, on Zoom, and there we can interact directly. So we have these webinar sessions. Earlier we had only on Sundays, but I was finding that only Sundays and sometimes I become occupied on Sundays and I'm not able to do that. So now onwards, we have started this series on Thursdays and Sundays. So every Thursday at 8 p.m. India time and every Sunday at 8 p.m. India time, we will have webinars on different topics. Already there is a series of learning about autism is going on, that is by name of lifespan management in autism, where we have completed 7 sessions, free for all, free for parents, free for professionals, every Sunday at 8 p.m. So there we have completed 7 sessions. In the 8th session, we will have on the coming Sunday. And this Thursdays, we have started additionally from today. This is the first session now. So we'll have on Thursdays, we'll have different topics related to autism and special needs. And Sunday, we'll continue with the series, what we are doing. So 7 sessions are already done. People who have just joined us new, and who have not seen any of our webinars before, you can go to our YouTube link. And on YouTube, you can search me as Arora Georgian, Arorageorgin. So when you search the YouTube link, you can connect with us. You can see the videos of the previous sessions. All the 7 sessions videos are uploaded there. So, and there are many more other webinars videos which I've done in the past. So you can see those webinars that should answer many of your questions. Now coming to the question, I have received a question just now. Hi sir, how to tackle when a baby starts crying or laughing with no reason? Very valid question. My dear friend, there is no behavior without a reason. So behavior is communication. So if baby is starting laughing suddenly or crying suddenly, definitely there is a reason for it. Nothing happens in this world without a reason. So what we need to do is observe the child, do the ABC analysis, antecedent and consequence. So what was happening before that baby started laughing? How long did it continue? Then observe the behavior, measure it, and find the cause. How did the behavior stop? Or what did child achieve by doing this behavior? Maybe child is doing it for your attention. Maybe child is doing it for escape. Maybe child is doing it for tangible. Or there could be underlying sensory reasons. So you need to do ABC analysis, relate it with function. So what is the function of the behavior? Could be sensory, escape, and then try to teach the replacement behavior to the child. What child is supposed to do when that need is there. So try to provide the sensory support, structured sensory support to the child. So this behavior automatically will eliminate. Once you understand what is the function of the behavior. So, but yes, the key takeaway here is no behavior happens without a reason. Definitely there is a reason for behavior. So Ikra has asked this question. So Ikra, I hope I have answered your question. You need to look deeply into the environment of the child at that moment when it is happening. Okay, now I have the second question from Natana. That is, it says, is vaccination outcome related to cause of autism? No, there is no scientific evidence so far. Many research have happened, and there is no scientific evidence so far that vaccination is the cause of autism. But many of the parents complain that only after vaccination, I could see the symptoms of autism in my child. Yes, that is true. Symptoms at times become visible after the vaccination because by the symptoms of autism and symptoms of after vaccination, a child goes into little slow phase because of vaccination. There might be a diarrhea, there might be fever, and that is the time when we give more attention to the child's symptoms. That's the time when we see, okay, child is not showing us the same symptoms what child was showing. Because the child goes into a little down phase for 2 days, 3 days, and from then on, we become more attentive towards child symptoms. That's the reason we see that symptoms are there. But scientifically, it is not yet proven that vaccination is a cause of autism. So I will stand with the thought that no, vaccination is not the cause of autism until there is a research comes in and that proves that. Okay, Balaji Sagar is asking, why does a child show tantrum behavior during task? Answer is for functions. What are the functions? During task, usually it is for tangible need, whether the child is hungry or child wants something. Usually it is for tangible need or for escapism. Child is finding the task too difficult, too lengthy, too boring, and child wants to escape from the task. But it could be sensory also. So what all materials you are using in the task, on depending upon that, if you are using, say, in the task, if you are using some um, toys which are, or some materials that are making big sound, and child is auditory hyperactive, child is not comfortable with that sound, child will show the tantrums. So behavior child shows during the task because of some reason, that those are functions. You need to do analysis of the behavior, different behaviors, different times, and then you will reach to the function. Same behavior can be used multiple times for different functions. Like I can use crying for escape. I can also use crying for tangible. So you need to carefully find out what is the function of that behavior. That's why I'm asking you all to uh, learn the art of ABA, the principles of ABA, learn the ABA approach, because this will solve a lot of queries, a lot of questions you have. What is the difference between shaping and modeling? Modeling is that we are doing things and showing it to the child, but shaping is rewarding at every step. So modeling is that we show it to the child like other two children doing activity and getting reward. So child also looks at that, okay, this child did this activity and he got the break. So I should also do this to get a break. That is called modeling. But shaping is that when child does the desired behavior for the first time, second time, we need to give some break. Even if child is not able to raise full hand, but child raises hand this much, then also we don't have to correct immediately that do this. No, correction will come later. Reward will come first. So immediately give the break. Child will. So attempt of attempt of behavior, positive behavior should be rewarded. Okay. Next question we'll go with. What replacement behaviors will you recommend for a child whose behavioral function is escape? First of all, work on antecedent, that is, give break well in advance when child wants to escape from a difficult activity. Make the activity little easier for the child. Let child have confidence on that activity and then go for difficulty level little low. Or if you see that child wants to escape, child has attention issues, or child gets tired in 15 minutes. After every 15 minutes, child wants to escape from an activity. In that case, at 14th minute, you give 2 minutes quick break. Or child has some sensory needs and child is say autism and ADHD, child wants to run here and there. So after 14 minutes, give 10 minutes of jumping or running from here. So within the activity, you add jumping, you add running with, so child will fulfill the sensory need, come back and continue with the activity. So depending upon child, see there we need to be very specific. No one formula will work on autism. In autism, each child is different. Each child needs a different. So no one formula works for all. So I cannot give you one thing that, okay, you do this. Depending upon child needs, when child is doing this escapism, when child is trying to use escape function, what behavior child is doing to get escaped. On basis of that, we need to teach to the child, or we need to avoid the escape function. So avoid in the sense, replacement behavior we need to teach. We can't just ignore. So replacement, escape is the need of the child at that moment. So you teach the replacement behavior and child will get escape. Do you do some private sessions? Private sessions as in consultations? Yes, I do consultations on children with autism, adults with autism, and I help parents to understand their child better. So I do online consultations where parents connect with me and I understand the child, take the inputs from parent, observe the child online if required, involve the child in some activities and observe. The whole session is nearly 1.5 hours. On basis of that, I make a document of minimum 20 to 25 pages where depending upon child's conditions, replacement behaviors, what all should be taught to the child, new ADLs, activities of daily living and all are involved in that in all the domains, not only in one domain. We look into the correction of the diet also of the child, providing right nutrition. So overall, adding on mindful activities. So I make a list of activities that parents can easily do, incorporate those activities in the daily routine of the child, and then do a follow-up also with you. So follow-up after 15 days is necessary. No one plan. So making IEP for the comprehensive development and for parents to do execute. And basis upon that, after 15 days, we do a follow-up and alter the program, because follow-up is very, very important. We are making the plan, but how child is able to perform the plan, how parent is able to execute it, what are the difficulty levels. So we ease out those difficulty levels. So after 15 days, we do a follow-up, and then the plan continues for 3 months. And we keep on monitoring the progress. Yes. So you may connect through my website, that is dralokarora.com or gkp.ngo, and we can fix up a session. Sir, how do I know my child needs ABA therapy and at what stage? See, ABA therapy is required when your child has behavioral concerns, when your child has learning difficulties. So ABA is not only a therapy. You don't have to do full-fledged ABA therapy if child is not having much of behavioral concerns. But even if you apply the ABA approach, you can help your child to learn faster. You can help your child to develop faster. So ADLs, independence level, can be increased with ABA. So full-fledged ABA therapy versus using ABA approach in your daily routines with the child, daily therapies with the child, whatever you are doing. So age, early intervention. We always talk in autism as early as possible. Usually from 2.5 years, 3 years, we can start doing it. So it is as early as possible. We should start providing support to the child. But ABA works with adults as well. It is not only for children. So I started practicing in 2005. So it's been 20 years now. 21st year is going on. Initial days, first 5-7 years, I was not aware about it. Okay. Then from 2010-11, I started learning about ABA, got certified on ABA, and then started using it as an approach in my all therapies. So along with this approach, for 7-8 years, I just continued only on children. And I believed that ABA is only for children. But 2018-19, when I started working with adults directly, and after opening this rehabilitation center for adults, we thought, why not to try ABA with adults? So pre-notion was, okay, development in children can come only till the age of 12, 1, 11, 13. After that, we can just teach them functionals, but we cannot do the development. I have seen miracles happening in Spandan. I have seen a child of 23 years who never spoke. Within 1 year, child is verbal. Okay, I have seen a 29-year child who was super hyperactive with the approach of ABA, with corrections in environment, with antecedent correction, consequences, replacement behaviors. Child is very I still call them child, even if he's 22 years, 29 years, 30 years, 32 years. So for me, because they are inmates of my rehabilitation, I consider them as my children. So I say child. So at the age of 29, within 6 months, with the approach of ABA, child is very well settled on behavior and the most disciplined child. Whereas now we don't provide any reinforcement. Initially we practiced. Now there is no reinforcement at all. There is no reward system. There are no instruction-based curriculum. So child is doing daily activities, learning, all those things are happening. So this approach is working even for adults. So there is no upper age for ABA. In fact, ABA is not only for autism, but it works with all of us also. Personally, I have used AB approach with my own family members to work on the behavior, not directly by telling them, but understand. And it has helped me to understand. My relationships with my colleagues, my family members have become much, much better now after understanding the ABC concept. Because I don't consider behavior as behavior now. If one of my employee is coming and shouting back at me, I look at the antecedent and consequence, not at behavior. So I just measure the behavior, understand the behavior for replacement. But first, I look at the reasons. What are the antecedents? Why the employee has gone into that behavior? So I try to understand that. So it helps. Okay, next question we go with. Some says ABA is not for kids below to 3 to 5 years. I have worked with children of 2.5 years also with ABA approach. So you need to mold your AB. You need to understand the foundations and principles. And then as per child age, as per child need, you need to use the approach. It's like how you are molding it as per the child's level. That is important. You can't go as per strict principles. Okay, this, after this, after this, after this. Rule will not apply to all children. And end result, you will see children have become instruction dependent. Children have become robotic, which is not accept and which is not our like desire. So using ABA approach, ABA therapy, as per the child needs, as per the child age, context, environment is very, very important. So experience makes you more kind of expert into it. More you practice, more you learn. What might be the reason of hand clapping or repetitive behavior? Okay, hand clapping and repetitive behaviors are usually for sensory reasons. The function is sensory. So why do we do hand clap? Or why do we do the repetitions? When we are overwhelmed, when we have over sensory information is too much for us, we try to control the input. So we are getting information from our senses regularly, 24/7. Brain is getting signals from eyes, from ears, from all the 8 senses are working and we are getting. Now brain is processing and integrating that information. I see a movie. So while watching a movie, I look at the screen. I see like suppose I see a hero there who's a character who's playing a hero role. I see him. I see a heroine. I see the family member or the house there. So I'm seeing multiple things. Eyes are seeing multiple things. Ears are getting multiple sounds, music sound, dialogue sounds. Something is happening in the background. Some dog is barking in the background, that sound. Now, brain, what it does, analyzes that sound, connects it with memory. Dog barking, oh, it's dog barking, looks at the dog, immediately where the dog is, oh, dog is there, and integrates what I'm seeing and what I'm hearing. Sometimes brain is processing slow, information is coming too fast. What if I run a movie in fast forward visually, but audio comes in normal? Will you be able to enjoy that movie? You'll not be able to connect with it because brain will not be able to integrate it. So when brain is not able to, and sensory integration concerns, sensory concerns are possible in 86% children with autism. 86%, that is a very big number. Some or other sensory concern. I'm not saying the sensory processing disorder, but some or other sensory issues are there in 86% children. Many of us, even though we are not diagnosed as autism, but we have SPDs, we have sensory issues. So to regularize ourselves, at times while sitting for long period, we start tapping our feet. When we are in an environment where we are a little nervous, we start playing with our knuckles. All of these are sensory. At times while sitting on the chair for long period, we start moving like this. Sensory issues. You sit in the classroom behaviors. When you're sitting in a classroom, moving or crossing our legs and moving them, tapping them, playing with our fingers or knuckles, moving like this on chair. These all are sensory behavior. So hand flapping, sensory behavior. Repetition. Now what I'm trying to do by doing repetition. You might have seen when you go for some interviews or when you are in a classroom, when somebody is asking a question to a lecturer or to a interviewer, interviewee, they usually, and from a politician or from anyone. So they usually they start their reply with, oh, that's a very good question. That's very relevant. Good that you asked this question. Why these steps? Are they trying to appreciate you or motivate you to ask more questions? No. Their purpose is to cross the input, because this is the familiar input which they know what they are speaking. So their purpose is to close the input, more input, and give time to the brain to process that information, what you have asked for, to get it from the memory and frame into a structured sentence that they can speak. So repetition usually happens. Repetition is what? Familiar words which child already knows. So if those words, that sound goes into child's ear, brain does not take much efforts to process that because that is very familiar sound. So brain is doing slow processing. Whatever as input has come, brain is taking time to process that. So when child needs more time to process the existing input, child does repetition or humming, or tones, different types of tones child starts speaking. Music, whatever child has heard, some song, child keeps on repeating the whole day. So that is to regularize their senses for the sensory senses. Okay. Next question we go with. I have a question, please. How can I teach my 9-year-old autistic daughter not to hug and kiss any strangers? Now, why the child is hugging and kissing these strangers? Now, if you do the ABC analysis of this behavior, maybe the reason is tactile. Maybe the reason is attention child is getting by doing it. So function could be sensory, function could be attention. What we need to do is, first of all, we need to stop giving that reaction. So no sensory input and no attention. If child is doing it, no attention. Sometimes child is doing it to listen that no from you. When you say no for child, that is entertainment. The child wants to listen no from you, and for that purposely, when you say no, child does it more. When you say no, child does it more. So we need to do the analysis of this behavior at multiple attempts of that, at least 15, 20 attempts with the antecedent. What was the antecedent? What is the consequence? Relate it with function. And then we can develop a strategy to work on this. Simply, I cannot give you, okay, do this and it will work out. No. So first we need to do the analysis. You can connect with me separately and we may work on it together. I will first understand. I'll help you to create a ABC plan and relate it with function, different behavior. So start writing the incidents when the child is doing it. Right from today, you start writing it. Come to me after a week. So at least 1 week data you have that child has done this behavior 10 times, 15 times, 20 times in this week. So what was the environment that time? Where were you going? Where did you meet the stranger? Somebody came home, so environment was home. Or you were going in a public park and the environment was there. So all of this we need, that data we need. And then how did child stop it? Did you shout at the child, stop it? Then shouting is working as reinforcement for the child. Maybe. So we need to look into what is your reaction on that behavior. What is the reaction of strangers on this behavior? All of that needs to be looked into. Then we'll be able to reach to conclusion why child is doing it. Once we know why child is doing it, we automatically will be able to teach the replacement behavior to the child. That need we can fulfill of that need of the child via teaching replacement behavior through reinforcement. Parent says that the kids do activities in center but do not do at home. Yes, because the generalization part is missing. Whatever I'm teaching to the child in the center, the same strategies are not being taught to the parent with the purpose. And they are not being included in the daily activities, daily routine of the child. That's what I was talking about, comprehensive ABA, where generalization part is important. So what is generalization? Any activity, any skill that I learn should be taught with different people, different environment, and different material. Suppose eating. So I am a young child and I have never eaten with my own hands. I have learned to eat with spoon, eat rice with spoon at therapy center with therapist. Therapist has taught me this skill. Now this should be practiced at a different environment at home. with a different person, with father or with mother or with grandmother. One by one, you need to change people also. And with spoon, with fingers, with fork, whatever you use. So material needs to be changed in a plate, in a bowl. Then the real generalization happens. So the reason is the child is not relating that I am supposed to eat at home also. Or child is not relating that I'm supposed to eat with mother also. So what child has learned with the therapist. Second reason is we as therapists do this mistake. Whatever we are doing in the therapy center, we want parent to replica that at home. Parent is already stressed, they are working parents, they have household things, and managing a child with autism itself is 24/7 job. So they are not able to find time to repeat that activity. So you give them the homework for half an hour, 1 hour, they are supposed to sit with the child and do that homework. Parent is not able to do it. For 1 day, 2 day, they do it, and in a week they do it 3 times, 4 times, and 3 days they are missing. Rather, when you plan the activities, you need to, whatever skills you are teaching, whatever strategies you are teaching to the child, they should be given into, included into, integrated into the daily routine of the child and parent. So you need to understand what is the routine of child and parent, and within the routine, don't add the burden on parent. Parent is already tired, already busy, already occupied, so or already stressed. So as therapists, messages to therapists that we need to create the same strategy, same goals, which can be easily doable at home within the daily. If I'm teaching color to the child, if child has learned to differentiate between red and yellow color, with the balls, we take balls or blocks. At home, you should not ask parent to go in the market and buy red ball and yellow ball and do this activity with the child. Or go in market and buy the blocks, red and yellow, and then do this activity. Rather, in the entire day, whatever child is seeing, wherever there is red and yellow, ask the parent to remind the child, ask the child which is yellow, which is red. So in the morning, when wearing t-shirt, red t-shirt, yellow t-shirt. When doing toothbrush, red brush, yellow brush. When going out going out towards the school, red car, yellow car. You can show it on the road. Red curtain, yellow curtain, red bedsheet, yellow bedsheet, flowers, red flower, yellow flower. Likewise, whatever things you are teaching to the child should be made as simple as possible. There should not be extra requirement of purchasing new material, new items, whatever is available at home. Let the child practice the same things with that one. Hand and eye coordination. In my clinic, I am doing it with the dart game, magnetic dart game. Do I need to ask the parent to buy a dart game to do hand and eye coordination? Or we usually at home we have those plastic or steel bowls and a small ball, a tennis ball. So tumblers or bowls with steel or plastic, you can shape them as pyramid, and with the ball, child can learn it. Child can learn it with pillows, soft toys. So child, you need to look into the environment of child, what is available. With that environment, you need to give and incorporate. Don't give extra exercises or homework to the parent. Incorporate in daily routine. So educating parent is very important, but at the same time, not increasing the burden of parent is equally important. Okay, next question. Sir, ABA के लिए भी बता दो, दोबारा से contact number देते हैं. I didn't understand this. आपको कॉन्टेक्ट नंबर अगर हमारा चाहिए तो आप www.jkp.ngo पे जा सकते हैं, या जहां से आपको ये मीटिंग इनवाइट का लिंक आया है आज, जिस नंबर से आया है उस नंबर पे भी आप कांटेक्ट कर सकते हैं. नेक्स्ट इज व्हाट एंटीसीडेंट may cause the child's tantrum. See, antecedent could be many antecedent. Just take for an example. Child is eating food. Suddenly, child is throwing tantrum. Child was eating easily for 10 minutes. And then suddenly, child is throwing tantrum. So, antecedent here could be child is already full. Child does not want to eat more. Or there is a chili in food, which child is not happy with. Or the food texture is changed. Child is not happy with the texture. So antecedent is what? Or child was eating with the mother every day, and today father is feeding the child. Mother is unwell, mother is not available, father is giving food. So change of people, that could also be antecedent for behavior. Change of material. Every day child eats food in yellow color small plate. Today that plate is in the sink. So mother decides, oh, who will wash that plate? Let me give food in bowl. Child is not agitated. Child is not comfortable. Child is like, I eat in my yellow plate. I want to eat in yellow plate. But child is not able to speak and tell this need to you. So child starts crying. So tantrum related to the material. Tantrum related to people. Tantrum related to environment. Every day I eat sitting in the dining hall. But today you are asking me to eat on sofa or on the floor. I'm not comfortable. So antecedents could be many, depending upon each case is different, each condition is different. So we need to look at the condition and then find out what is the A, B, and C. Okay, that ends with the questions. Any more questions anyone has? Or we can wind up for today. We have a chat group also for the webinar. So we have webinar chat group where WhatsApp group where we publish some reading material, recording links of the sessions, and add on the Zoom links and all we give there. So I will request the coordinator Gaurav to kindly share the WhatsApp chat group link also with you all via WhatsApp or via email, so that you all who are not there in that group, you can join the group. You can get timely information about the webinars that we are conducting, about topics, and you may ask your questions in the chat group also. Next question, one more question has come. How can we improve attention in autism child? Again, these are very general questions you are asking me. I am saying before doing analysis of the child, it is difficult to give you a strategy. Attention building activities, there are a lot of attention building activities for the child. But depending upon the child needs, we need to shortlist the activity. I can give you a list of 100 attention building activities. Just WhatsApp me or email me. You can go to my website and find my number from there, dralokarora.com. Just WhatsApp me. I have 100 plus activities. I have a document on that. I can share that document. But whether which activities will be beneficial for your child, that we can know only after doing understanding the child. So each child is different, where how child and after understanding also we need to follow up. So we need to alter also depending upon child's response to those activities. So in general, I cannot give you any one or two, three activities. It is simple for me. I can still straight away say those activities, but I don't want to do that because no one formula fits for all. In autism, I have seen parents following the advices of other parents. My child is improved with this tonic, or my child is improved with GFCF diet, gluten-free diet, or your child is hyperactive, immediately stop sugar. All of these are myths. Before doing the assessment for your child, you should not do these things. Because if you are stopping the child from dairy products or sugar, or you're putting the child on GFCF diet, nutritional imbalance will take place. And that nutritional imbalance will lead to other concerns. So you need to plan a balanced diet. And why should all children should be deprived of chocolates? Why should all children be deprived of wheat or dairy products? Not all children in autism should be put on special diets. Hyperactivity somewhat is related to sugar, but sugar is required for the body. It is required for the brain development also. Fat is equally required for the brain development. Protein is equally required. So proper balance of carbohydrate, fat and protein. So timely intake, when to give it, how much to give it, when to stop it. This all is considered only after doing a detailed assessment. I have seen this many pediatric rehabilitation centers across the globe. Hardly there are very few handful of them who have a dietitian trained on autism on their panel. But diet can directly impact behavior. Diet directly impacts the development of the brain, development of the children, overall development, physical and cognitive as well. So equal importance should be given to diet and nutrition. And my dear parents, please stop doing experiments with your children. They are living human beings. You need to treat them with respect. No experiments just by listening from someone, this helps or that helps. Until you do a detailed analysis of your child, learn more about the condition, how it is going to impact your child's health, growth, and then reach to take expert advices and then reach to solutions. Please do that because they are living human beings. They are not objects that you can just mold them and press them anywhere you want to just to tune them. No. Okay. Any other questions? No. Not a problem. This is a mission I have to support the community, support parents, support professionals. So you all can connect with me from jkp.ngo or dralokarora.com, all the both the websites, or via comments in our YouTube channel. So we'll be putting up this video also on YouTube. So you can comment on YouTube channel. And I would request you to subscribe, like, and share. So share with other parents, subscribe and like, give us reviews. Your reviews matter a lot to us. Thank you very much. Good night.